We have a lot of experience with cases involving skin cancer and specifically melanoma, which is a form of skin cancer that is malignant, which means it's a cancer that can travel throughout your body to other important sites like your brain or your lungs, as opposed to some localized skin cancers which don't spread. And we have a lot of experience with melanoma and the failure to diagnose melanoma. We've seen a number of cases involving melanoma where the doctors or hospitals failed to properly have a very suspicious skin lesion reviewed and analyzed by the pathologist in the hospital. A pathologist is a person who looks at the skin cells under a microscope and determines whether you have a melanoma. If you remove a melanoma when it's very early, like most skin cancers and most other types of cancers, your cure rate is close to 100%. And that's certainly true with melanoma. Unfortunately, sometimes a melanoma skin cancer will not be reviewed by pathologists. What we've seen several times is where a very suspicious skin lesion, like what somebody might call a mole, which is a dark raised spot on your skin, is looked at by a doctor and is removed, and sometimes that mole is actually not sent to the hospital for analysis by a pathologist to determine whether you have a melanoma. In fact, we've seen some situations where the mole is removed but then thrown away and never analyzed. And of course, later on in time, that mole will grow back and it's a melanoma, and by then it's often spread to other parts of the body, and survival is very unlikely. So if you believe that you have not been diagnosed properly with a melanoma, then you should give our office a call. We can talk to you and it's free of charge, and we can review the medical records, and if there is some tissue that was held by the hospital, then we can have that analyzed by experts to determine whether they properly evaluated and determined whether you had a melanoma that was not diagnosed.